Hello, ladies and gentlemen. Welcome back to the Spinal Hygiene Podcast. I'm Dr. Tabor Smith, and today we're going to be talking about acute home spinal care. So if you tuned into the last episode, we talked about home spinal care, which are what can we do to keep our spine healthy between chiropractic visits. But today, I'm going to be talking to the people who might be in pain right now. And we're going to talk about a couple of different strategies that will help us to keep the symptoms down, but also help benefit our spine and understand why we use each one of these therapies. So the first acute home spinal care procedure I want to talk about is the use of ice therapy. Now, ice therapy is mainly used for acute situations, which means if you just have an injury, the first 24 to 72 hours, you want to apply ice or an ice pack. So you would apply an ice pack to the affected area. Let's say my lower back was hurting. I tweaked it by, in the gym doing a squat or something like that. I get home, it's hurting. Then we want to take an ice pack and cover it in a towel and lay it on the affected area for 15 to 20 minutes. I always tell my patients never exceed 20 minutes. So then you take it off and you let it rest for about an hour. You can do this multiple times throughout your day, but just put the ice on for 20 minutes. Take it off and let it rest for at least an hour. Ice is great for lowering inflammation. That's why we use it right after an injury, because usually directly after an injury, inflammation appears. Ice can help you keep that down. Now, the other therapy that we'll talk about today is heat therapy. And a lot of people like heat, but it's not always my first go-to recommendation. Of course, contact your chiropractor, ask their opinion on what you need to do. In fact, that should be your first step, is when you do injure yourself or hurt yourself, especially if it's involving your spine, unless it's an emergency. If it's an emergency, go to the emergency room. But if it's not, contact your chiropractor, set up an appointment, and then you can apply these types of therapies. So heat therapy, let's talk about that. This would be in more chronic conditions. Let's say if you have a chronic lower back that flares up all the time, but it's the same thing, it's the same spot, then you might reach for heat, because heat is going to help with pain and is also going to relieve some muscle tension. What you would do is you would take a heating pack. You could microwave, or you could warm up, or you could use a heating pad that you plug in. Don't ever put it on its highest setting. We need to make sure that you don't burn your skin. But you would apply that heat pack to the affected area. And you can keep that heat pack on for 20 to 30 minutes. I always tell my patients, don't leave a heat pack on for more than 30 minutes. Take it off, let the area rest for at least an hour, and then you can reapply that heat as you go. Heat is not something I reach for in the beginning, because heat can actually flare up the inflammation in the area. So you need to make sure it's a chronic condition if you're applying heat. Now, the last therapy combination I want to share with you is actually a really good one. It's called contrast therapy. And it's what I actually tell my patients to do. If you really like heat, a lot of people just love that feeling of heat and it relaxes them, then use this contrast therapy. It's where you would use ice and heat. And you would always end in ice. So let's say if my lower back was aching, it's kind of a more chronic condition, but I'm in a flare-up, then yeah, I might apply heat for 5 to 7 minutes. Then I'm going to apply ice for 5 to 7 minutes. And I could do that cycle again. Apply heat for 5 to 7 minutes. Apply ice for 5 to 7 minutes. And for 30 to 40 minutes, I could just keep that cycle. But remember, always end in ice, because ice has the anti-inflammatory or lowering inflammatory qualities. And so if we end in ice, we're actually going to be ending with keeping that inflammation down. But we still get the great benefits of heat, relaxing muscle tension. And sometimes this contrast between ice or heat can actually increase blood flow to the area and help you feel better. Now, the last thing I want to end with in this episode is that you need to be able to get in a comfortable position. And so some of the most comfortable positions, especially when we're talking about spine or back issues, is when you're laying on your side and you have a pillow in between your legs. Now, another comfortable position I've found that my patients say is if you're laying on your back and you put a pillow underneath your legs. That's an area where you can get comfortable and get some pressure off your spine. But even if you're laying in these comfortable positions and resting, which is a good thing, I want you to get up about every 50 minutes at least, maybe even 45 to 30 minutes. I want you to get up and walk around a little bit for 5 or 10 minutes. We don't want you totally bedridden, unless, of course, there's an emergency or there's a major situation or your doctor has told you to do that. But we want you to get in that restful position, that comfortable position, but then every 45 minutes to 50 minutes, get up, take a walk, and get the fluids moving and stretch it out, all right? So I hope that helps. Acute home spinal care is definitely something that you need sometimes, but once you get past that pain, once you get past that acute, painful situation, then talk to your chiropractor and get back into doing your regular daily home spinal care exercises. I hope this episode helped you. All you people out there who are having that back pain, contacting us, telling me, what can I do right now? It's Acute Home Spinal Care Procedures. Contact or check out the book, At Home Spinal Care. You can download that for free at homespinalcare.com, and it talks more about these acute home spinal care procedures. Thanks so much. We'll see you on the next episode.